Welcome back. Yes, let's get straight to this one. And Dr. Patrick Dakum joins us this morning. He is the CEO of Institute of Human Virology, Nigeria. He's a virologist. Good morning, sir. Thank you for joining us again today. Well,
good morning, Chamberlain, Kayode, and Ayo. Good morning to all of you out there in Lagos.
Thank you. Well, these figures have since doubled. Now we've got over 20,000 cases and huge concerns. Why aren't these figures dropping? When are we going to pick? So many things going on in people's minds about where we are. So for you, is it that we're not doing something right, or this is a natural course, the way it will play out? It gets worse before it gets better.
Well, thank you very much, Chamberlain. We have been on this program a number of times, and I think virtually most public health physicians like me, or generally virologists, have already indicated, and I think even the Presidential Task Force has made it very clear that this is going to be the trajectory, and unless we do something very drastic, the trajectory is going to be this way. Are we in a second wave? I don't think we're in a second wave. We're still on the rise on that first wave. And for Nigeria, my prediction is that there may not necessarily be a second wave. There may just be one huge wave that is prolonged over a period of time. And it was something we saw coming. It was something that prevention, very, very aggressive prevention measures could have slowed down. But unfortunately, we are where we are now. And therefore, we've got to just deal with the situation the way we have found it now. But that's the reality of where we were. By April 16th, I think we were just about 4,000 plus. By May 16th, we went up to almost, by April 16th, I think we were just in the hundreds. And then by May, we went to some thousand. By now, we are now getting to 20,000. So it's over exponential. And therefore, it calls for an over-exponential response. That's the way I think, too.
But Dr. Dakum, what kind of response would that be? Because I remember the PTF saying, look, the reason why we had to ease some of this lockdown, the economy was very central in our decision. What decision do you expect us to take at this point in time?
Well, it's the age-old response. We are not going to be doing something extraordinarily different. The only thing is that we should be able to do that with a different pressure. And by different pressure, what are we talking about? Well, first of all, the measures that we know are, of course, the non-pharmaceutical measures that has been preached. It has been said over and over again. And that is the wearing of face masks in especially public places, the washing of hands with soap and water, and then, of course, the maintenance of some level of social distancing, avoidance of major crowds. These are the public health measures that we know. And how far are we going with that one? Even the PTF has already rated that as very low. So the question is, what do we do about that? And I think that what we need to do is a combination of both soft and hard measure. Sometimes, unless people see somebody taking the brunt and going through some level of a disciplinary measure, it's difficult for them to relate to it. We have said stay at home, and the stay at home has resulted into an economic chaos, and therefore we say, okay, go out, but go out safely. Now, going out safely, people are now basking in the euphoria of an ease of lockdown and just going about their life like nothing has happened. So it means then that there is going to be now a combination of the carrot and the stick. We need to figure out how to bring in both the national security and NSCDC, the mobile courts, to bear alongside with what we have advocated earlier on, and that is using the structures at the community to continue to advocate to people. I think that, like I did mention earlier on, the churches, mosques should take this war. But I think it has gone beyond that now to now family. Every person that believes that you are a true husband, you should take responsibility for your family. And by taking responsibility for your family is doing what is right. So if you, the head of the house, is not doing what is right, It's difficult for anybody to do it. Majority of people come from homes, whether it's a single home, you are alone or you are with people, but take responsibility. So government has said that, look, we are giving you the tools. Wear your face mask, maintain social distancing, make sure that you wash your hands. Will you or will you not do it? Well, the answer lies in your hands. Is like the story of the proverbial old woman in the village where, because of her wisdom, most young people believe that they should pose a question that she cannot answer. And so they caught a bird and brought it there. It was alive, put it at the back of their hand and their back and said, "Old wise woman, is this bird dead or alive?" And then, of course, she knew what it was going to be. If she said it was alive, they will squeeze it and it will die. If she says that it is dead, they will release it. So how will she get out of it? Well, she looked at them and said, "Look, young men, the answer to your question lies in your hands." And so for me, I throw it back to individual in communities. Will we survive the COVID pandemic or not? Well, for you family heads and for you community heads, for you religious heads, the answer is in your hands. Offices should do what they should do. The different workplaces should do what they should do. But then the answer lies in our hands. The other leg of it, like we have mentioned, is the need to deliberately now, state governments take responsibility for aggressive testing.
I don't know how
we have
effective.
been told that virtually every state now has a testing.
Dr. Dakum, I'm not sure how much responsible, how more strongly we can preach this message of people being responsible, because I mean, at various levels, at the federal level, at the state level, at the local government levels, at even the traditional levels, religious levels, all these conversations have been going on. A number of people still have very serious doubts. I mean, one would have expected that a city like Lagos, for instance, where the numbers are very, very high, the sense of responsibility would be equally high. But that is not the case, because I had reason to go to a major market last week, and I found that even some security operatives that I saw around were not wearing the mask at all, or not wearing it properly. Some of them just had the mask like some beard, right under their chin there. So if the responsibility of the stick end of the carrot and stick is in the hands of the security officials, who themselves may or may not have too much confidence in the whole idea, how do we go forward? So when we're talking about this carrot and stick approach, I'm wondering how we're going to go about it, especially, sir, since things are going to get worse in that the temperatures are dropping. It's the cold season now. What do we need to do? I'm trying to follow up on that question Chamberlain asked. What further response can we take now? The weather was hot before, at least slightly hot. Now it's going cooler with the rains really pouring. So what response would you suggest that we should take, whether as a people or as government or at whatever level?
Well, you have said that we've already preached the sermon the extent to which we can. There will always be unbelievers. There will always be people who will be skeptics. That one, you cannot avoid it. But it will not stop you from doing what you should do. I went to the village. Not to the village recently, some time back. And one thing that I asked the primary health care officer there was issues related to the reproductive health, family planning, etc. And I just found out that for him at that level, after graduation, he had never received any training, even though several trainings had been done in the past. And for me, he was the voice of health in my village, and therefore should be able to preach the sermon on a daily basis. And we had to organize for some level of training to take place there for himself and a few others. I think that there is a need for a constant retraining of the primary healthcare workers that carry the voice of health at every community. We have mentioned the fact that there must be a rejuvenation of the primary healthcare structures that are in the villages. Every village, every ward has a primary healthcare center. There is a committee. The committee is made up of the traditional ruler, the religious leader, the headmaster or principal of the school, the healthcare worker. They make up the gatekeepers of that community. To what extent have we reached out and are working with these structures? I think the penetration is still very low. If you go, yes, we talk about it that, oh, we have preached it. Yeah, we preached it on radio, we preached it on TV, but go down to the village and talk to the healthcare workers, even at the primary healthcare level, they are grappling with what is the correct information. It's not going to be a short distance race. It's going to be a very long distance race. And let us not be discouraged in the fact that there are people that don't believe for now. It will come to the point where as they get to meet more people that are positive and they see the effect, the reality will be dawning on them. We've gone through this curve with HIV, where people did not believe, they don't, and up till today, there are so many people that are skeptics, even after 20-something years of programming in this. Yet you still have quite a number of unbelievers. But it must not remove our eye from the focus of going right down to the grassroots, going right down to the structures that really people listen to and talking about it. The general knowledge is that we have made the message. The reality is that, you know, the message is not there. There are two things. We say of KAP, knowledge, attitude, and practice. The bridge between knowledge, which is what is generally known. Do you know about COVID? Yes, I know about COVID. Oh, but do you practice wearing a face mask? No. Do you practice washing your hands? When I see now. So what is the bridge? The bridge is attitude. And attitude can only be solved if there is a deliberate interpersonal communication that goes right down to the grassroots. Standing on the pulpit, for example, and say, wear your face mask, is not just enough anymore. But the message must go down to the little subgroups and the reasoning, why is it that you people are worrying us on this matter, is not true. Somebody debunks the myth and it goes on. So yes, on the surface, we have gone, you can say knowledge is high, but practice is extremely low. Attitude is the bridge. And to solve that attitude, we must go right down to interpersonal communication.
Well, just one more thing. I think you need to debunk this myth as well. There is the word out there, some misinformation, if you like, that some people are carrying around. Some medical practitioners in certain parts of the world are saying that it is unhealthy to wear masks. They say that it causes asphyxiation or whatever it is. Can you explain that, to us?
So let me give you an example with what I do when I go to take a walk. Okay? I hope I get this right. Okay? When I go to take a walk, what I do is that before leaving my house, I go this way. When I step out of my house, I am walking, and far ahead there, I see two other people that are coming. I see the street very clear. There is nobody coming left, right, and center. I go this way, and I take my mask down. And when I do that, I'm able to breathe and I move around. Immediately, I notice that there are people coming, or I approach where I live. There's a place where you have all these Kekenape people gathered. As I see them far away, I put on my mask back. And if I see a number of people walking by the side, I put it on. The idea is that I do not want a situation whereby I will enter their breath space. Whether they are symptomatic or not, they can transmit if they have. And I do not want to take that slight chance of doing that. When now I'm sitting down there, your cameraman is several feet away from me, and I do not have to put on the mask. I'm breathing freely. But when I go to a place where there are people sitting not too far from me, I put it on. Okay? So I do not think that you should put on the mask and then have the mask there 24/7. The only other time, of course, is when I go into gathering. Well, because of my age, I don't go to the church service, even though the church has opened. But if I'm going to go there, where even with the social distancing, I'll put my face mask on. When people are far away from me, I take it down to get some air. But you must be very, very cautious, because we know that this virus is highly infectious. And because it is highly infectious, we must be extremely careful. The other thing, of course, is that apart from the face mask, it is only one out of it. The face mask alone will not protect you 100%. You must combine it with the washing of hands. Immediately, in my pocket, even before I get back to my house, I have not shaken anybody. I have not done anything. You'll find out that right here in my pocket, I have my little sanitizer. Put it on my hand, rub it, because I may mistakenly just take my hand to my face. My wife has said that, myself and my brother especially, that she thinks that if we don't touch our face every 15 minutes, we will not be happy campers. But that's true. I have mentioned it here that we averagely touch our faces between 70 and 100 times daily. So I now rub my hand and I take personal responsibility. So everything that I need to do, I do. I tell my household also what to do. My community, what we have done is we provided the face mask in my village. It's called the Mupun Cultural Development Association. We all came together. Somebody brought 500 naira, 1,000 naira, 10,000 naira. I think we gathered close to almost 1 million. And then we just got a lot of face masks and took it. We said, all you this, especially the elderly that you insist you must go to market, etc. on market, please wear this. Why would we wear this? This disease is not in our place. We say you should wear it because those of us that have read more than you are telling you this is the best thing to do. And if you believe in us, believe in what we are saying. So we do all of this. And I think everybody should take responsibility. Let's not give up. We have gotten to the point where people are exasperated. You drive around, you see nobody wearing a mask, nobody doing anything like social distancing, and the tendency is for us to give up. But my message is that do not give up. Do not give up. As more and more people who should do the right thing, do the right thing, and as our leaders take responsibility, they will. But I know your time will soon be up, but let me just mention the other thing that is important in this drive and aggressiveness that I say we should take. And that is, we should be able at some point to begin to narrow this infection to communities and to clusters. And the only way we can do that is if every state governor will take responsibility for testing in his state, take responsibility for additional testing site, providing all that. Now that people have been released and they are doing some economic work, I'm sure that the next thing is that, oh, no need to give them palliatives. Well, what are you going to do then if you are not going to? So spend the money as a governor to put additional testing sites. In my state, for instance, I have been in constant conversation with the governor of Plateau and said that, look, do all you can. I know you have one testing site, another one is coming up. Get 2 or 3 or 4 testing sites. Use the resources in order to get it so that if we can now do massive testing, look, we will be able to say in Abuja, here are the communities. And so we put those communities on a total lockdown of some sort. You know, we send health officials to those places as an army to go and address it. When you are fighting a war, you need to concentrate on where the enemy is. And this enemy now is a virus that we know we can find out by testing. So if we should rate every governor now on the COVID by the number of tests that are carried out. And once we now identify the positives, that cluster, because you get it from another person, so there will be clusters. We can now lock up that clusters. Look at what's happening in rivers now.
Yeah, just a minute.
We are going to lock down.
Okay, let's just add a couple of more questions before we wrap up. For instance, this, the new information keeps coming up time and again. Now, ever since NCDC have revised their protocol wherein you don't have to test negative twice for you to be discharged, and then the transmission by asymptomatic people. Now, is it 10 days? Is it more? And people feel, well, if that's the case, how do I know he's up to 10 days? And so, does that contribute in the way people respond to being on guard about this?
I think it's good information that after 10 days, a person is no more infective according to what the science says. The virus is no more infective, means that its capacity to be able to infect another person has been, quote unquote, broken. But it does not mean that it should we should lessen by that percentage our effort at prevention. Why do I say that? You have already said, the Chamberlain, that how do I know that this person is on his 8th day, 9th day, 10th day? And when we say 10 days, it's approximate. I will be on the safer side to say that once somebody is tested positive and is asymptomatic, ensure that even if you test positive after 10 days, you are asymptomatic, you are no more infected, does not mean that if I am the one that is infected, I should now say, oh, it's now 10 days, guys, come and let us hug. No, I should still be very careful. I should now dovetail back into what any other person in the community should do. Yes, it is good that the person is no more infective, even though it's positive, and therefore it will release and reduce the bed space pressure for those that needed to be on admission. But it does not and should not reduce the level of preventive measures that we should be taking. Remember that we said that we will only get to where we want when we get to get a vaccine, and that is like a year and a half or two away. So my advice is that please do everything that you can. Work with your community, work with your worship center, whether it's a mosque or a church or your village. Do something, but don't just do nothing.
Now let's see if you can, as we wind down, paint a picture of where we're trying to get to. So, I mean, it can give people a sense of, how to fall in line. Now, you said that maybe we will not have a second wave, but you see that this will be one big wave. And it begs the question, just how big will the wave be in terms of figures, in terms of, duration? Are we looking at July? Are we looking at August? Just how big is this? Because a lot of people will say, well, I wore my face mask, I social distance from people, but look at where we are today. So the question is, just how big is that wave? So people can have a sense of where we're trying to get to.
Well, it's extremely difficult to put a figure because, like other scientists will keep saying, that putting number is difficult because a lot of people that have put, even the US that put a number out to say that this is the number of people that may likely pass on, they didn't get it quite right. In fact, they underestimated. But if we look at from 400 after 1 month, you get to 5,000. From 5,000 after another month, you get to 17,000. You can do the maths and now say that if we continue and don't do anything, remember that the people we are testing now are people that are already infected. New infections, as a result of the carelessness of people, we are still going to see that effect as we move on. So if we are not careful, within the next 2-3 months, Nigeria may get to the over 100,000 cases. And it's just a guesstimate, because the virus behaves in the way it behaves. And it is a new virus, and it's like building a ship and sailing the ship at the same time. We're building it, we're sailing it. So we're learning about it, we're taking action, and together as we support what the government is doing and support the PTF and support all that is going on, I believe we will take responsibility, and at the end of it, we may slow it down if we are more aggressive.
All right, then, Dr. Patrick Dakum, thank you very much indeed for your thoughts this morning.
Thank you very much, and you guys stay safe and have a good day.
Thank you. We will be back in just a moment and delve into another matter. It's politics, actually. Stay with us.